Hello, everyone. Welcome. Welcome to the Brain Health and EU Launch Forum brought to you by UNLV. I am your host and moderator, Dr. Zhong. I am a geriatric psychiatrist, the Director of Innovation and adjunct professor in the Department of Brain Health and at UNLV. I hope everyone is excited about the talk today. We have quite a few crowd here. This is a monthly lunchtime conversation with the doctors, researchers, faculty members from UNLV to discuss the topic that is so important to all of us, brain health. On the fourth Wednesday of each month, starting from September this year, and 12 o'clock, lunch hour, the expert will be joining by Zoom to discuss a very wide range of topics. For example, how to take care of your brain health, what's new in the Alzheimer's world, and what you can do to stay healthy and sharp, and many more. We will be providing on the latest research, share with you some very practical tips and recommendations, and most importantly, to answer your questions. So feel free to use the chat box to just put your questions, and then we will try our best to address those questions in the hour to follow. At the end of this forum, we will be sharing with you the email address where you can actually submit the questions and including some of the future topic that you wish to hear. Last month, we have talked about diabetes and brain health. Today, we will be discussing sleep and your brain health. We know that sleep is critically important to all of us, no matter the age, gender, race, occupation, and health conditions. We spend more than 1/3 of our lifetime sleeping. That's a lot of years. So why do we need sleep? And how many hours of sleep should we have? And what are the consequences if we don't get enough sleep? Are there any long-term downstream negative impact of sleep deprivation on our brain health, such as Alzheimer's? We're going to find out. So joining me today, 4 great panelists who will answer those questions. I will begin by introducing Dr. Graham McGinnis, the assistant professor in the Department of Kinesiology and Nutrition Science. His research interest is in the area of circadian rhythm and the impact of food, light, exercise timing on the sleep-wake cycle. Our next panelist is Dr. Jin-Yong Kim, associate professor in the School of Nursing and a sleep researcher. Her research includes the sleep-related breathing disorders such as snoring and obstructive sleep apnea. She also studies extensively the shift workers' sleep health, and we sure have a lot of those shift workers here in the city of Las Vegas. Our next panelist is Dr. Donna Marie Krause, assistant professor and occupational therapist in the Department of Brain Health. Her research focuses on innovative methodologies of clinical practice that close the health disparity gap. Our last panelist is Dr. Jeffrey Cummings. Dr. Cummings is a neurologist, research professor, and the world leading expert in Alzheimer's disease and on the development of the new therapy for brain disorders. Dr. Cummings is the director of Chambers Grundy Center for Transformative Neuroscience and UNLV. So welcome, doctors. Thank you for joining me. I would like to start the conversation with Dr. Kim, if I may. So Dr. Kim, your research is really cover a lot of areas, but I wonder if you can share with our audience, first of all, why do we need sleep and why is it so important for us to sleep?
Okay, so hi everyone. I know why we sleep is the basic question about sleep, right? But actually it's not an easy question to answer because the modern sleep research began only like 1 century ago, like only 100 years ago. We still do not know much about sleep, why we sleep, but by the intensive research studies during the past decades, we now have several pretty good theories about why we sleep. So first theory is repair and restoration theory, saying that sleep is essential for revitalizing, restoring our physiological functions so that we can keep our body and mind properly functioning during the day. Right? For example, our cardiovascular system should slow down during sleep about 20 to 30%. So for example, our heart rate slows down, our blood vessels are relaxed, and blood pressure goes down during sleep in order to be stored and work hard again the next day, right? And then a lot of repairs occur during sleep as well. For example, protein synthesis, cell divisions, and tissue repairs, those stuff. So for example, the growth hormone, which is involved in all those repair and growth activities, peaks during the sleep, especially early at night between 10 p.m. and 2 a.m. So this is why all children should go to bed early at night, right? And then another important reason we have to sleep is for immunity, right? So when we get a cold or flu, the first thing we have to do is to go to bed and get enough sleep, right? To be recovered. So many studies show that the activities of our immune cells decreased because of lack of sleep up to like 70%. So sleep is really important for our immune system. And then there is a information consolidation theory. So we believe that people sleep to process all the information we acquired during the day. So like in a second, we have all this visual and auditory information, right? And we cannot, and we don't need to remember everything. Right? So we believe our brain prunes the information right, during sleep so that we can remember only important stuff for us. Right? Also, we transfer those information into long-term memory during sleep. Right? So yeah, so sleep is very important for learning and remember things in your memory activity. And then the last but not the least theory is cleanup theory. So this is the most recent theory about the function of sleep proposed like only several years ago. So researchers found that our brain has its own waste disposal system that cleans itself of toxins and waste produced during the day from their normal activities. So researchers found that brain cells actually shrink during sleep to make more spaces between brain cells. And then cerebral spinal fluid can like flow easily between brain cells to flush out those waste. So yeah, I believe we will talk more about this later today, right, with Dr. Cummings. Yeah,
Sure.
so
Well,
let me stop here.
Thank you, Dr. Kim. Sounds like sleep is so important, both physiologically, emotionally, and among many things. So I just want to make sure that we actually capture some of the important points, Dr. Kim. You talk about during the sleep that the heart rate decrease, and then that's actually from some literature, we understand that sleep actually is a very effective anti-hypertensive treatment for people, because that actually can lower your blood pressure. And secondly, that formation of the memory also took place during a sleep. So that is very important for people to have good memory, to have a good night's sleep. You also touched upon really enhance the overall immunity. I think especially during the COVID, that is such an important area. People talked about how we can enhance our immunity from taking different supplements, taking obviously vaccine, but I think this is one of the easiest way to help you to enhance your immunity, that is to sleep well.
Yes.
Last but not least, you also talked about the clearance of some of the protein that built in the brain. I wonder if I can bring Dr. Cummings onto the discussion right now, just on this particular topic, in terms of the clearance of the toxic protein in the brain while we are sleeping.
Yes, thank you, Kate. So there are two main proteins that accumulate in the brain in Alzheimer's disease. They are amyloid and tau. So those are the names of the two proteins, and the amyloid forms a plaque. You may have heard about plaque, and the tau forms a tangle. So we have plaques and tangles in the brain that result from these proteins that are accumulating in the brain. And just as Dr. Kim said, these proteins are cleared from the brain during sleep. And the corollary of that is that sleep disturbances are a risk factor for Alzheimer's disease. And we think that this is because people who have poor sleep or reduced sleep do not clean these proteins from the brain. They accumulate in the brain and they eventually cause Alzheimer's disease. So it's a very cutting edge new set of thoughts about how to treat Alzheimer's disease and what predisposes us to Alzheimer's disease, and the key relationship between sleep and Alzheimer's disease.
Thank you, Dr. Cummings. I think that's so critical for us to keep in mind. Dr. Kim, since we talked about the importance of sleep, what are the current recommendation, the guideline as to what is considered as the optimal hours of sleep we should get?
Yeah, so 7 to 8 hours is recommended for adults, including older adults, by the
7
National
to 9,
Sleep.
you said?
Yeah,
7 to
9 hours of sleep.
Okay.
Yeah, for all adults, including older adults, by the National Sleep Foundation. And for teens, like 9 to 11, 8 to 10, or yeah, in some studies they say 9 to 11. And for schoolers and preschoolers, so 9 to 12 or 10 to 13 hours. So it's a lot more than we expect, actually. So I know some people may say, I'm totally fine with 5 to 6 hours of sleep, right? So whether there is a natural genetic short sleeper exists or not is still a mystery in the field of sleep. But there is a research group at UCSF found a gene of short sleepers, but the gene is too rare to account for all short sleepers. Yeah, so yep.
So I wonder how many of us actually get 7 to 9 hours sleep on the regular basis. I can see some heads actually shaking. So, if what we heard from you, okay, somebody's crying here. Not quite 9 hours sleep, but obviously there is individual differences, but sounds like the overall recommendation is to really get 7 to 9 hours sleep. So what happened during the sleep? We hear that, you have deep sleep and shallow sleep, and there are different stages of sleep. Can you share with us a little bit about different stages of sleep?
Yeah, so sleep mainly consists of two phases, REM sleep, rapid eye movement, REM sleep, and non-REM sleep.
REM, right?
Yeah.
Okay.
REM sleep and non-REM sleep. And non-REM sleep is again divided into 3 to 4 stages: stage 1, stage 2, and stage 3 sleep. So when we close our eyes and fall asleep, we start from stage 1, light sleep. So which is transitioning period between wake and sleep. And our sleep deepens via stage 2 and stage 3, and then proceed to REM sleep. So this is one cycle, which takes approximately 60 to 90 minutes, depending on people. And we repeat this cycle of REM and non-REM sleep 4 to 6 times during sleep. And the stage 3 sleep is called the deep sleep stage, also slow wave sleep stage. So we see beautiful, like slow and high amplitude brain waves during this deep sleep stage, stage 3 sleep, which is the most important sleep stage for physical like restoration, physical recovery, and like also memory consolidation as well.
Okay. Well, thank you for that. So we also understand that during the REM sleep, this is where your brain became really active. You know, this is where you dream, a lot of vivid dream and memory formation and consolidation. But this is also the time where your body literally is being paralyzed, correct? So that will prevent you from acting out of your dream. So I think that's important for people who actually have the REM sleep disorders. This is where they sleepwalk, sleep talk, and that's sleep disorders. We have a couple of questions here, if I may just bring them up and talk about. Someone asked like, all he gets is an hour and a half of sleep. Wow, Ned, you really don't get much sleep at all. So what is the minimum amount needed for the body and brain to clear those proteins?
Yeah, there's no such minimum hours of sleep. We need to clean up those proteins. But what we know so far is this deep sleep stage is really important. And this deep sleep stage occurs mostly during the first half of the night. Right? So if assuming that we sleep like 8 hours, the first 4 hours, we have a lot of deep sleep stages. So I would like to recommend at least having like 3 to 4 hours of sleep to get enough deep sleep stages.
Thank you. The other question that came in was asking about any other negative impact if we don't get enough sleep. We hear about the clearance of the amyloid. So that's really having impact on the overall cognition. I wonder, Dr. Kim or Dr. Cummins, if you can touch upon some other aspect of the negative consequences. For example, I think you touched upon the cardiovascular, what happened during the sleep. So if we don't get enough sleep, what happens cardiovascularly, emotionally, among other things?
Go ahead, Dr. Kim.
Sorry?
Go ahead.
Okay. Yeah, I will go back to the cardiovascular diseases, right? So like I said, our cardiovascular system should slow down 20 to 30% to function properly during the day. So for example, when we have sleep apnea, obstructive sleep apnea, which is cessation of breathing, right? So repeated obstruction of upper airway. So if we stop breathing for like seconds, our brain like regard it as like signal of dying or something like that. So they try to wake us up, right? So our cardiovascular system and other physiological functions wake up again. So they don't get enough rest, right? So it can be a risk factor for development of cardiovascular disease in the future. Also, like, for example, sleep apnea causes oxygen desaturation because it's like a cessation of breathing. So this like desaturation and reoxygenation, repeated this desaturation and reoxygenation produced a lot of reactive oxygen species. right? Which increases all the systemic inflammatory response in our body, which are also risk factors for many diseases.
Thank you for that.
I would just add one thing to that, Kate, which is, the most common consequence of sleeplessness is drowsiness during the day
Yes,
and accidents while driving.
yes.
So it's really, very straightforward. If you don't sleep enough, your body is going to seek sleep at times that you don't want it, shouldn't have it, and can cause harm by falling asleep. That's just sort of an elementary reason that sleep is so important.
Exactly. I think there are also some very interesting information. And we know that we all go through change of clock during the springtime and fall time. So there are data showing that when we move the clock forward, and then so that means we lose 1 hour sleep during the spring. And that Monday, there are about 20 to 25% increase of cardiovascular related disorders.
Wow.
And so that's
heart
very
attacks, yeah.
Exactly. And then when the fall comes, when we actually gain 1 more hour sleep, and then the prevalence of the incidence of the stroke or cardiovascular disease dropped on that Monday. So, that's really based on millions of people. It happens every year. So I think that's a very powerful message. And we talk about impact on the overall memory, cognition, and cardiovascular. One thing that I think is also important for people to keep in mind, which is actually common sense, is people get groggy and sometimes people get grumpy. So that then also really has quite a bit of negative impact on our overall emotional well-being. Again, another interesting data showing that during the spring of the time changing, the overall decision made by the judges were harsher because they believe the hypothesis was the judges were in a bad mood because they didn't sleep well. And so I think that we probably all have some of our own personal experience as well. So since we talked about the need for sleep and our body knows when we don't get enough sleep, I'm going to turn to Dr. McGinnis. Your research is in the circadian rhythm and the sleep-wake cycle. Can you share with us what that means and why is that important?
Yeah, thank you. And I'm really excited to be here. Thanks for the introduction on sleep, Dr. Kim and Dr. Cummings. So my topic is going to be about the circadian rhythm. And when we talk about this, what we're really describing is any physiological process in the body that recurs in a 24-hour cycle. One of the most common things that people immediately think about is their sleep-wake cycle, because it is so inherent in our 24-hour day. So what's interesting about that is that there's this two-process model for sleep pressure. One being that we're driven to sleep by the amount of time since the last time we slept. So if you stay up longer and longer, you want to sleep more. But the other process is this circadian rhythm, meaning that there's a time that your body really wants to go to sleep. And luckily, we've evolved in a world with a 24-hour pattern of light and dark, and our body adapts to that by secreting a hormone called melatonin at the onset of darkness that helps us go to sleep and stay asleep and get our healthy 7 to 8 hours of sleep a night. Unfortunately, we have also grown accustomed to artificial light, food that's available all around the day. So we have a bunch of extra input that we aren't used to evolutionarily having. And these things kind of fight against our biological rhythm or our circadian rhythm. And they disrupt these circadian rhythms. And invariably that leads to the onset or the sensitivity to different kinds of diseases like cardiovascular disease, metabolic diseases, or even neurodegenerative diseases.
Thank you, Dr. McGinnis. So sounds like what you're describing is what we probably will call our internal clock that can regulate when we wake up, when we need to go to sleep. But there are many other external factors that can really screw that up. And then our sleep wake cycle can be impact. You mentioned about the light. I know that probably all of us here use iPhone, iPad, sometime in the evening or just before bedtime. Can you tell us a little bit how that potentially can impact on our overall sleep quality or quantity?
Yeah, so I'll go back to this kind of evolutionary example of how we became 24-hour creatures, I guess. And the circadian rhythm is kind of housed in this special group of cells in our brain. It's got this great name. It's called the suprachiasmatic nucleus, which we aren't going to quiz you about later. But this little brain center is really sensitive to input from light. And when this system evolved, the only form of light we would be exposed to is sunlight. So sunlight would hit our eyes and set this little clock in our brain and tell us that it's daytime and we should be up and active. And this brain system actually sends out signals to all the different cells and organs in our body, like our hearts, to tell us and to tell our heart that it's daytime, it's time to move, run around, hunt, forage, etc. So now that we have the availability of light 24 hours a day, and we often enjoy looking at a TV screen or a phone screen, our brain and our body gets confused because it's getting the same input, but it's getting it at the wrong time of day. So at night, we're getting this big flash of blue light to our eyes, and our brain is saying, hey, it's daytime. Let's get up, let's hunt, let's forage. But really, your body needs to be going to sleep. So you can see how this light might actually be making sleep a little bit harder or a little bit worse. It can also be harnessed for good, much like the original scenario I presented with waking up with the sun. Not everyone gets to have a beautiful sunrise from their bedroom, but you can use these artificial light products like bright light boxes, and you can use them to stimulate the beginning of your day and kind of increase the amplitude of your circadian rhythm. So some of the recommendations for increasing alertness and things like that during the daytime would be to expose yourself to bright light early on in the day. So whether that's going outside and spending some time in the sunshine, or whether it's using an artificial product like a light box, you can use this to help strengthen your circadian rhythms when it's used at the right time. But if it's at the wrong time, later in the day when you're trying to go to sleep, it won't be very helpful.
So what would you recommend that, what will be the optimal time when people stop using their iPhone or iPad, like an hour, 2 hours before they go to sleep?
Yeah, you would want it to be several hours before you go to sleep, and you want to make sure, and I think Dr. Krause is going to talk about this, that your sleep environment is just that. It is an environment that you're dedicating to sleep. It's dark, it's cool, it's comfortable, things like that. And there's a lot of good new and old research that looks at hospital environments that are flooded with light at all times of day, and how disruptive that can be, and how people in rooms with windows that have more natural light actually have better outcomes, shorter hospital stays, and things like that.
That's very interesting. We have a question for Dr. McGinnis. It says, besides anxiety, why is it sometimes very hard to fall asleep, even when one is exhausted? Is it from disruption to the circadian rhythm?
That's a great question, and I'm happy to have any input from other panelists if they have a good answer for this. But I think that there can be some habitual things if you're trying to go to sleep at a time that's earlier or later than normal, that you kind of miss your opportunity to kind of fall asleep quickly. This happens a lot during jet lag, or if you have something that you want to get up for early in the morning, you spend your time thinking about, am I going to get to the airport on time or something like that. So it can be a little bit more of a mentally taxing process than just relaxing and going to sleep. But also if it's at a different time than you're accustomed to, that can also be particularly problematic.
Great, thank you. You also just mentioned very briefly in terms of the impact of food and timing of exercise. Can you share with us a little bit on that, please?
Yeah. So our circadian rhythm really has three main drivers or timekeepers. And the first one we talked about is light, and the other two are going to be food, what you eat and when you eat it, and activity like exercise. So there's been a lot of cool new research showing that the amount and timing of food that you eat drastically changes how your body responds to it. So if you can consolidate your feeding window into smaller periods of time, there's a whole lot of research on this time-restricted feeding. But at a minimum, trying to make sure you don't eat really late in the day, close to bedtime, that can be particularly disruptive to sleep because you're making your body work when it should be resting and repairing, as Dr. Kim was saying. And this includes, of course, things like caffeine or alcohol, because those are going to, again, make organs like your liver and your GI work extra hard when they're supposed to be relaxing.
So I think that just on that topic, sometimes people do not realize caffeine actually has a relatively long half-life. It's about 6 hours. By that we mean if you have a cup of coffee around lunch hour right now, then half of that will still stay in your system by 6 o'clock in the afternoon. And then by about midnight, it still have a quarter of that in your system. So that in a sense, the caffeine actually has a long impact. So that for people who do have some difficulty falling asleep, I think over recommendation is you really shouldn't be having coffee, probably beyond morning time, isn't it? Another thing people tend to use is alcohol. You know, they have a glass of wine or so. They say we'll get relaxed and then we'll go to sleep better. But in fact, that's not quite the case. I wonder if Dr. McGinnis can talk a little bit about that. You know, alcohol can make you more relaxed, but actually it doesn't really help you to sleep. And then in fact, it can actually wake you up during the middle of the night.
Yeah, there's a couple of ways that can be disruptive. The first one I mentioned is that it's going to make your liver kind of work on purifying the blood and kind of filtering this alcohol, so your liver isn't getting a chance to relax. But also it's a diuretic, so there's a better chance that you'll have to get up in the middle of the night and use the restroom. And that is another, Dr. Cummings kind of mentioned the propensity for falls when tired and things like that. Getting up in the middle of the night can also be another really dangerous time when you may be prone to accidents.
Mm-hmm, mm-hmm. So is there any guideline what time you should be drinking alcohol? If you were to drink alcohol, probably not 5 o'clock.
Yeah. So that's interesting, and there's been, again, a lot of cool research on this, including kind of fun named experiments like the tailgate experiment, where people would consume alcohol at different times of day.
Uh-huh.
It really is kind of an earlier the better. However, that's not very socially acceptable on most days. So it might be best to avoid it later in the afternoon and evening when possible.
We'll take that by heart, Dr. McGinnis. Does weather play a part in the context of having sleeping trouble?
So seasonality definitely can. We talked a little bit about the time changes, in which case we have a natural experiment that we all lose 1 hour or gain 1 hour of sleep. But also, as far as the seasons go in Las Vegas, we're about to get to my least favorite time of year, when it's dark at 4:30 and it's still dark at maybe 7 or 7:30. And that's when people can be kind of prone to things like seasonal affective disorder, where there's not enough natural light to cue this circadian system. And in those kinds of scenarios, it would be beneficial to expose yourself to some nice bright light, even artificial light, early on in the day to really amplify the circadian rhythm and boost this rhythm.
Thank you for that. We also have quite a few questions. I'm going to address them one by one. One audience asked a question about the shift work. Even people get enough sleep, like 7 to 8 hours sleep, but they sleep during the day. So what kind of impact that may have on them for shift work? I'm going to turn to Dr. Kim. That's part of your research.
Yes. So, yeah, I started research about shift work as I moved to Las Vegas in 2019. So it's still the beginning state. But so shift workers, first of all, it's really hard to get like 7 to 8 hours of sleep. And then the problem is, and then another problem is, even though they have this enough sleep hours, it's really hard to have like deep restorative sleep because of this input of light during the daytime, right? Mm-hmm. So those are two important factors. But the good news is research studies says only 20 to 30% of shift workers complain suffer from this short sleep duration and like daytime symptoms like excessive sleepiness, something like that. So we believe that there is inter-individual differences in the capacity to adaptation to this shift work schedule. And it may change the impact on the health outcomes. So yeah, I'm working on that.
Well, thank you. Keep us posted. I think you also touched upon during our earlier discussion about the resilience. Some people might be more resilient than other people. I think that's one of the research area you are currently focusing on, isn't it?
Yeah. I'm trying to identify some subtypes of shift workers according to the level of resilience or intolerance level to their rotating shift schedule. Mm-hmm. And what is the signature of their brain waves during sleep and how it's related to the development of Alzheimer's disease and other diseases in the future.
Well, please do keep us posted. I'm sure that will be very eager to hear your outcome and your result. There's a question for Dr. Cummings. The sleep aid medications such as melatonin and Ambien and others like them, are they successful in brain and body rejuvenation?
Thank you, Kate. It's complex to think about these medications. As far as we know, if sleep occurs, then the mechanisms that clean proteins from the brain will also occur. However, as a person who works with older people, drugs like Ambien or alprazolam or Valium that are sedatives are highly likely to be associated with drowsiness in the morning or kind of an unclear feeling in the morning. The danger of falls is definitely increased. Dr. McGinnis mentioned this. So there are lots of downsides to artificially inducing sleep with a so-called sleeping pill or hypnotic. Now, there's a really interesting development in the field, which applies directly to what Dr. McGinnis has been talking about, which is drugs that restore the circadian rhythm. Rather than putting somebody asleep, They restore nighttime sleep and daytime wakefulness. There are two of these on the market, suvorexant and lemborexant. Suvorexant has actually been studied in Alzheimer's disease and shown to be successful in improving sleep in Alzheimer's disease. So that's one of the few drugs where we really have really great data, phase 3 trial, double-blind, placebo-controlled, all the things you want to see are all there for that drug in that study, and it was a positive study. So we're excited about that. Moreover, one of the things that I think is going to be so interesting is if we can help Alzheimer's disease patients sleep better, do we actually improve their cognition, and can we improve their behavior? And those studies are now being formulated, and I expect in the next year or two to have really interesting information on the effect of better sleep on cognition and behavior.
Well, that sounds very exciting. So Dr. Cummings, the medication you were just mentioning, is it available right now on the market? If the patient or the family want their doctor to prescribe it for their Alzheimer's patient, can they do that?
Yes, so both of those drugs are available on the market. Now, our healthcare system is one where often you have to try a cheap drug before you can try a more expensive drug. And so they might have to go through a tiered system to get through to these drugs that we actually think are far better to use if one has to use a medication to restore circadian rhythm.
Thank you, Dr. Cummings. We have a question about sleeping with pets. So on that note, I'm going to turn to Dr. Krause to really help us understand the importance of the sleep environment from the occupational therapist perspective.
Thank you, Dr. Kate. I really appreciate being here. I think I always have to start with what is occupational therapy. And that's a branch of healthcare that works with individuals from kids to elderly adults to participate in everyday activities, which we call or know as occupations, and that includes the occupation of sleep. So the question about pets, we'll kind of maybe get to in just a moment. I don't know that I can address it specifically, but we do know that sleep disorders impact 70 million people, and they increase 10 to 20% of healthcare costs. So we know that, as we've heard already from Dr. McGinnis and Dr. Cummings and Dr. Kim, that it's a common problem and it is affecting healthcare costs. So it's therefore something that we're looking at and studying. And even from an occupational therapist perspective, considering what is sleep, and just in a functional performance definition, we look at sleep as activities. So all activities related to obtaining restorative rest and sleep, which support, as we've heard from Dr. Kim and Dr. McGinnis and Dr. Cummings, healthy and active engagement in occupations. And so there's 3 components to sleep, the activity of sleep, that we look at as occupational therapists. And that's rest, which is kind of that personal state of relaxation. But we look at the environment that creates that. And then Dr. McGinnis really highlighted how important that environment is to identify the need to relax and just to rest in a quiet, effortless action so that we aren't involving mental and emotional energy. It's just kind of a state of rest. The second component would be of sleep would be sleep preparation. And I think this is the most important part that we spent some time talking about, but I think individuals can really look at and identify for themselves is the routine of getting ready for bed. And so when we look at sleep preparation, it's looking at just changing clothes, saying goodnight to others, having a routine, meditation or prayers. But as Dr. McGinnis said, and it's really important, is deciding what time to sleep. And as Dr. Kim said, knowing how long to sleep and really trying to, in that sleep preparation, set the alarms to make that happen. Setting up any machines that need to help with breathing during sleep. So when we look at components to sleep as occupational therapists, we're looking at rest, sleep preparation, and then sleep participation. That's that actual stopping of any activity to engage sleep, laying down and transitioning to a sleep space to ensure participation in sleep. So we've talked about some things to avoid, like coffee and food 3 hours beforehand. Don't eat a large meal, alcohol, even high salt foods, because it's engaging the organs and the body. But things we can do are keeping a dark, quiet, cool room. We've talked about that already. Our sleep environment is so important. Having a regular quiet time. So turning that screen off about 90 minutes beforehand or even longer, so that our body just knows and our brain begins to wind down, so to speak. And then managing stress. So using maybe mindfulness techniques, but finding opportunities to manage stress, because we know stress really hypes up that body and the systems of the body that rob sleep and kind of, but they secrete and keep our systems awake. So sleep is really a pillar of lifestyle medicine, and we need it to treat, prevent, and reverse even chronic diseases. As everyone has highlighted already, it is really important, and it's becoming so important that research is now being looked at to what is it, why is it important, and elements that we've talked about already. So as occupational therapists, we really, for little kids all the way up to older adults, we're looking at the purpose of sleep, healthy sleep habits, healthy hygiene, so that we can prevent falls. We can help people that maybe seem as common sense, but we maybe need another set of eyes to look at. So that's why we're becoming involved in it, to help people deal with it and be healthy as another component towards health and decreasing healthcare costs.
Wow, that's wonderful. You know, we at times tend to take it for granted. We just go to bed and we sleep, but this is very informative, how we rest, how we get the environment prepared, and how we actually anticipate and prepare us an environment. So thank you very much, Dr. Krause. I'm going to turn to Dr. McGinnis for a minute, if I may. So far, we have talked about the light, we talked about the food. Also, you touched upon a little bit about the exercise. I know that one of your research area is on the timing of exercise. I wonder if you can share with us a little bit on that.
Yeah, and I've seen a couple other questions pop up. I don't know if we're allowed to address them out of turn. But maybe we should save them for later.
Go ahead.
I'll stick with the exercise timing.
Okay.
So we talked a little bit about how the body kind of has the times of day that it wants to do certain tasks. At night, when you're asleep, it wants to repair and rest. And then during the day, it's primed to be active and perform. But it's not equal throughout the entire day. The body's actually best at exercising in the afternoon. In fact, almost the majority of world records are set in the afternoon, not in the morning. However, if you've ever been on a sports team, or if you've ever had to go to the gym before work, sometimes you have to exercise at a different time of day than your body really wants to. So maybe it's because your team has morning practice, or maybe it's because you can only go to the gym after you drop the kids off on the way to school, or something like that. It's a matter of convenience for most people, except for Olympians. And it turns out what we've been seeing is that if you exercise at a time of day, it can drastically change the way your body responds to it, as much as saying it might not even be that beneficial. It could be interpreted more as stress or a distress than a eustress or a good stress, which is what we always think of exercise as being. And this can happen, I would say, by two ways. One is that exercise is one of our inputs. It's one of our timekeeping tools. So if you're exercising at a time of day that is like out of synchrony with your circadian rhythm, you could be pushing your circadian rhythm away from its kind of healthy, normal 24-hour cycle. Mm-hmm. The other reason we think that exercise at the wrong time of day could be bad is because your body might not be truly resilient during certain times of day. And this can be related to sleep, or sleep disruption, or sleep deprivation. So what we found is that if people prefer to be night owls, for example, if you like to stay up late and sleep in late, if you're forced to exercise early in the morning, you were more likely to get injured, and you had a greater inflammatory response to exercise. So that's an example of how fighting against your circadian rhythm can kind of further exacerbate different types of bad responses.
So in another word, understanding your body, understanding your pattern, and it's very important to guide you with regard to the timing of exercise. So the question is, what is the best time to exercise? I think that question just popped up.
It depends on your goal, and that's a really common question that comes up a lot. If your goal is to achieve your personal best time, lift the greatest amount of weight, or any of those types of factors, then it's probably going to be in the afternoon. There's a circadian rhythm in your body temperature that primes your body for best performance in the afternoon. And there's a number of other reasons, but the afternoon is going to be the best time to perform best. But if you want to use exercise as a timekeeping tool, for example, to strengthen your circadian rhythm as a tool, as a cue, then morning exercise is actually really beneficial. And it's also, there's been some studies looking at morning exercise versus evening exercise and its impact on sleep quality. And morning exercise seems to be better than afternoon or evening exercise.
This is such a fascinating information. I think we actually have quite a few questions coming as well. But before I address those questions, we have about 10 minutes left. I think this has been a very rich discussion so far, and I hope that all of you can join us a month in November, and we're going to show you the time for the next discussion that is on exercise. So just talking about the exercise. But I would also, go ahead, Dr. Cummings.
I want to ask you a question, Dr. Kate.
Go ahead.
So one of the most striking things about sleep is dreaming. And you're a psychiatrist, right? And 90 years ago, there was a very influential psychiatrist named Sigmund Freud, who really convinced a lot of people that dreams were very significant, very important, very influential, very information oriented. So as a psychiatrist, what is the importance of dreams now?
Well, thank you for that question. I think that, as you pointed out, 90 years ago, even 50 or 40 or 30 years ago, there have been a lot of emphasis, even during our training, on the analysis of dream, which has a lot of connotations. But I think as we are moving more towards biology, I think the dream, I'm not an expert in terms of dream interpretation, but I think right now people tend to think that as more of a random pieces that happen during your sleep, and then that can also be a way of how the memories or how the information can be synthesized. And as we heard, that dream usually happen during the REM sleep. So it can be random. I don't think that from my personal perspective, that has something so significant in terms of the interpretation of the dream truly means something to your life event. To me.
Thank you.
Okay, I answered that. I'm going to get back to you, Dr. Cummings. And what will be the one important key message you want our audience to take away from your perspective based on our discussion today?
From my perspective, find ways in your lifestyle to achieve normal sleep. It has so many consequences, both near term and long term. So I just think we have to work harder on figuring out how to optimize sleep.
Thank you. Dr. Kim, what would be your advice to our audience?
Yeah, on top of Dr. Cummings' advice, I would say, so try to find your optimal sleep hours between 7 to 9 hours. So my optimal sleep hour is 8 hours. So if I sleep solid 8 hours of sleep, next day my condition is so different from others. And try to have regular bedtime and wake time. And if you are suffering from insomnia right now, just go to bed when you feel sleepy only. So don't spend too much time in bed.
Thank you for that. I think that one important issue we have not addressed is true medical sleep disorder. I think that there are time and a place where you really need to go and seek professional help, talk to a doctor, talk to a sleep expert, and then there is a whole host of ways in which that we can help you to understand, to evaluate the underlying sleep disorders. Dr. Krause, what would be your recommendation, your key message for our audience today?
I think my key message would be that sleep preparation, the routine and environment for sleeping, can improve the quality of the occupation of sleep. And I'm going to answer a question that was in there. Can pets improve sleep? Evidence says yes for women and children. So that's what evidence would say, but I think that really depends on for the individual.
Right. I think that there are also literature showing the other way, particularly if the pet being very active during the night. So that can be interference. I guess depending on how you train your dogs or your pets. Dr. McGinnis.
My take-home message would be that you get to tell your body what time it is. It does know on its own, more or less, but you get to decide when it gets light, you get to decide when it gets food and activity, and you can use those tools if appropriately timed to give yourself better sleep and a better opportunity for good quality sleep.
So listen to your body is important.
And what you tell your body.
Exactly. We had a lot of great information, and what we have not talked about is some useful references and links and potentially books and websites. So I know that there are, for example, Sleep Foundation of America. They have very helpful information tips. And AARP Global Council on Brain Health, they have published the sleep issue, specifically addressing sleep change, sleep management in the elderly people. I wonder if our panelists have some other suggestions with regard to references where people should go and seek some additional information if they need.
Yeah, there is American Academy of Sleep Medicine. So they have a lot of information about sleep in their website, and also NIH. National Center, they have National Center on Sleep Disorder Research and have also some useful information for public. And there is sleepnet.com. So if you want more information.
Andy, our Director of Communication, thank you, Andy, for supporting us. Can you share with our audience the email address in which that they can send? Perfect, here we go.
Certainly, and I'm also going to drop it into the chat in case anybody wants to copy and paste. There it goes. It has two links, actually. It has the email as for you to email us and send us questions or comments about this event or future events. And it also has engage.unlv.edu/brainhealth. That's actually the URL to register for future events. And with that, we look forward to seeing you. Thank you for participating today.
Thank you all for participating. I think that we have shared a lot of very interesting and important information. We would welcome your feedback, and we look forward to seeing you in 4 week time. Thank you all.
Thank you.